Could you pronounce this word for me?
Oh. Poststreptococcal. I have no idea. Glomerulonephritis? I don't know.
Could you pronounce this word for me?
Poststreptococcal Glomerulonephritis.
Sir, could you please pronounce this word for me?
Poststreptococcal glomerulonephritis.
Miss, could you pronounce this word for me?
Poststreptococcal glomerulonephritis.
Winner.
You know what we're covering in class today?
I have no idea.
What's up, guys? How's it going?
Pretty good. You know what's covering in class today?
Poststreptococcal glomerulonephritis.
Okay.
You guys ready to go?
Yeah. So I think I'd rather just be going back to T class right now.
How's everybody doing?
Good.
Alright, so today's lecture is on poststreptococcal glomerulonephritis. Alright, so a brief overview of poststreptococcal glomerulonephritis, or PSGN, is a complication of bacterial infections, Streptococcus bacteria, inflammation of the glomeruli and small blood vessels in the kidney. That's basically what happens. And some signs and symptoms: hematuria, oliguria, hypertension, and edema, and more. Alright, so let's break down some of these signs and symptoms. So, anybody want to tell me, what is hematuria? Seriously? French? I know I had you in med term. Sadinsky? Alright, so what's heme?
Blood.
Barber. Yes. Urea.
Urine?
Yep. So
Blood in your urine.
Sadinsky. Good job. Alright, so how about this one?
Decreased urine?
Yes. You guys better know hypertension. Come on.
High blood pressure.
Yep. Edema.
Swelling.
Alright, so as stated, this disease is a result of a streptococcal infection. So streptococcus, type of bacteria, it's a gram-positive bacteria, and there are several types. So since we're talking about poststreptococcal glomerulonephritis, we have to talk about the kidney. So some basic components of the kidney. We got the medulla, the cortex, the renal artery and renal vein, the renal pelvis, the ureter, and the renal capsule. Right, so nephron is the most basic structural and functional unit of the kidney. So are there any questions so far? Barber.
Yeah, just one question. Why are you on a bike?
You know, there was just a little too much of a headwind this morning on my ride in, so just deciding to get a little bit of a quality ride in right now. Alright, so the glomerulus.
Nice socks.
What was that, French? Alright, so back to the glomerulus. Plural form glomeruli. Cool word, guys. You know, you could be sitting at dinner and you could talk to your parents about how I at the end of some words, like how plural. Never mind. Okay, so passage of blood through the glomerulus. So blood enters through the afferent arteriole and exits through the efferent arteriole.
where'd he go?
I
Oh,
don't.
there he is.
Oh, hey.
All right, so when the glomerulus is operating as it should and forming filtrate, there's high pressure in the glomerulus and the fenestrated capillaries of the glomerulus. Yeah, you guys remember fenestrated capillaries? Human phys, human anatomy. All right, so the fluids and the soluble materials will filter out into Bowman's capsule, forming filtrate. All right, so poststreptococcal glomerulonephritis pathophysiology. So, as stated, there's an infection of the skin or the throat, Streptococcus bacteria. Inflammation of the vessels in the kidneys results, and the kidneys are not able to filter the urine at a normal rate, and the signs and symptoms develop. Does that all make sense?
No.
Well, what was confusing about it?
I don't know. To me, it just makes about as much sense as throwing the ball on second down in the Super Bowl when you got the best back in the league. You know what I'm saying?
All right, Barber. I'll remember that on your next exam. So, just some general information. So having streptococcus impetigo, those are risk factors for PSGN. It is rare that these conditions result in PSGN, though, because of modern antibiotics.
About as rare as a World Series win in Seattle.
You too, French. And it's often seen in children 6 to 10 years of age. So, kind of like we talked about earlier, we already hit on this a little bit, but the signs and symptoms, so decreased urine output, rust, cola-colored or tea-colored urine. Next time you're drinking Coca-Cola, think about this. Global swelling and blood in the urine, which can be microscopic or macroscopic. So, treatment for PSGN. So mainly antibiotics treat the streptococcal infection that caused it in the first place. And that's pretty much PSGN. And since this was a pretty general slideshow on it, I want you guys to give me a more detailed presentation on poststreptococcal glomerulonephritis.
This is a more in-depth explanation of some of the signs and symptoms and the mechanisms of them. Hypertension, that was the first symptom the patient experienced. The patient experienced a blood pressure of 158/92 millimeters of mercury. Hypertension occurs in 80 to 90% of the cases of PSGN. The mechanism of hypertension in PSGN is retention of sodium in water, and plasma renin activity is usually low. The patient experienced a blood pressure of 158/92, which is well above normal range for blood pressure, considering hypertension begins at 140/90. Normally, sodium would be excreted with a normal glomerular filtration rate, but in this case, the subject has an inflammation of their glomeruli. As a result, there's a decrease in GFR, and this doesn't allow sodium to be excreted properly. We all know that water follows sodium, so when we retain water, we have a greater blood volume, and this increases the pressure in the blood vessel walls. The retention of sodium in water directly relates to the suppression of renin activity. This is because high sodium concentration in blood affect renin secretion. This can affect other hormones down the line, like angiotensin II and aldosterone. Another symptom a subject with PSGN would have is, or could have, is Bizold's abscess. Our subject experienced honey-crusted pustules on her right face and neck. Today, this Bizold's abscess is extremely rare. It is a complication of the mastoiditis, and it originates from Streptococcus species bacteria, and if left untreated, it's extremely dangerous. They're called Bizold's abscess because they were first discovered by a man named Friedrich Bizold. These are extremely rare today because of current antibiotics. They occur in the deep muscle planes of the neck by the mastoid process. There's pus formed from the mastoid tip cells caused by Streptococcus bacteria. This is what one of the abscesses would look like. If left untreated, it could be extremely dangerous because it'll travel to the spinal cord and towards the brain.
Another indicator of poststreptococcal glomerulonephritis is the darkening of the urine to a red or brown color. This color can also be described as cola-colored or tea-colored. This is typically one of the first symptoms experienced by individuals with PSGN, in addition to decreased urine volume. The reason that the urine becomes dark like this is because of blood within the urine. More specifically, it's due to the proteins and the red blood cells that have penetrated the basement membrane of the glomerulus. PSGN typically occurs 1 to 2 weeks following a throat or skin infection, typically caused by the Streptococci bacteria. The patient in our case study claimed that she had contracted impetigo from one of the students at her school, so she's currently 1 week post-impetigo. Impetigo is a bacterial skin infection and it is highly contagious. In an effort to fight off the infection, the body produces extra antibodies. These antibodies then settle on the glomeruli and cause inflammation, which eventually results in glomerulonephritis. The patient in our case study also claimed that she had been suffering from global headaches. The headaches that she's experiencing may be a result of swelling or edema. In PSGN, a common area for edema is the paraorbital region. Swelling in this area may cause an increase in the pressure within the cranium and the meninges, and this would be the reason why she's experiencing global headaches. Edema is another common symptom of PSGN and is typically one of the first to set in. The patient in our case study presented with pitting edema of the ankles. The edema is a result of an increase in hydrostatic pressure as well as an inflammatory response. The inflammation is caused by irritation from the red blood cells and the proteins that have settled on the basement membrane of the glomerulus. Varying degrees of elevated protein levels in the urine, or proteinuria, are also a common symptom within PSGN. Glomerular vessels help to regulate the flow of blood by contracting or dilating the blood vessels. If this function is diminished due to PSGN, the vessels can constrict, causing an increase in blood pressure. A prolonged increase in pressure can lead to damage to the glomeruli, which can then lead to proteinuria.
One common symptom of PSGN is elevated serum creatinine levels. When measuring kidney functionality, glomerular filtration rate, or GFR, is used. When measuring GFR, creatinine is a very important substrate. This is because it acts as an indicator as to whether or not the kidneys are functioning properly. Under normal circumstances, creatinine is freely filtered through the glomerulus. So creatinine is basically just a waste product. In conditions that damage the kidneys, such as PSGN, creatinine is not filtered properly. As a result, creatinine will remain in the blood, causing high serum creatinine levels. Our next symptom is low serum complement levels. Basically, complement is a collection of blood proteins. This is called a complement because it literally complements the major immune responses. While PSGN usually presents with low serum complement levels, the exact mechanism is not quite known. However, it is known that the complement is inactivated by immune complexes. Basically, an immune complex is just an antigen-antibody grouping. When these immune complexes are present, it can inactivate parts of the complement cascade. This is ultimately reflected in the low serum complement levels. There are many diseases that can affect the complement system. However, the part of the complement cascade that is affected is dependent on the specific disease. In PSGN, the C3 component of the cascade is affected. This can also affect other components down the line. Another symptom commonly seen in PSGN is a heart murmur or other types of cardiac complications. However, in our case, this symptom was not seen. But since you're wondering, I'll go ahead and explain. As Nick explained earlier, hypertension occurs often in PSGN. Hypertension can compromise the structural integrity of the heart. In addition, damage to the arterioles and capillaries can occur within the heart. When the structure of the heart is damaged, the functionality of the heart also diminishes. When this functionality is diminished, cardiac complications can manifest. One common complication is a heart murmur, but our case study didn't have that one. Okay, so let's talk about treatments. Because PSGN results from a bacterial infection, the use of antibiotics is the normal treatment. With antibiotic treatment, the clinical course is usually less severe for the patient. Also, antibiotics will prevent the spread of the disease to other people.